Hey, Dr. Spencer Charlet here with Active Spine Chiropractic in Mooresville, North Carolina. Just kind of want to go over with you a little bit about what chiropractic is, and this is what I explain to a lot of my new patients. So here's Chiropractic 101, just for a little bit of extra knowledge. Basically, this is a plastic model of your spine. Here's the front, here's the back. These are your hip bones, also known as your pelvis, your tailbone, low back, mid back, and neck. Now each one of these bones are designed to move forward, backwards, side to side, independently of one another. And each one of these bones, called vertebra, are separated by a very important cushion called an intervertebral disc. Now I'm sure most of you have heard of a herniated disc or a bulging disc. That's what this red area down here represents. If you have a herniated or a bulging disc, or if these discs are inflamed, they're not going to be able to perform one of their two main functions. The first function these discs perform is a shock absorber. So whether you're bending, twisting, running, jumping, sitting, anything you do, they absorb the stress and the shock of your bodies. The second thing they do is they create the space between these two bones, the much needed space for these nerves to come out. So if that disc is injured, or these joints don't move correctly, that nerve's going to get irritated. If that nerve's irritated, you're going to feel pain, numbness and tingling, or possibly burning. So what do chiropractors do? Here's what we see more often than not. We notice that some of these joints in your spine kind of rotate and get stuck to one side or the other. When they get stuck, they further irritate these nerves. What happens then is they'll send a signal to your brain saying, hey, something's not right, help us out. So what your brain does is it comes down here and tightens up all the muscles. So now you have a joint that doesn't move, a nerve that's irritated, and muscles that are real tight. A lot of times you can take muscle relaxers or ibuprofen, the muscles will relax a little bit, the pain will go away, but within a few days' time everything comes right back. That's because this joint is still stuck. What we do is we take these joints, get them moving again, so that once this is moving correctly, that nerve irritation goes away, cuts off the signal to the brain, relaxes your muscles, and everything gets better. This is Dr. Spencer Charlet, Active Spine Chiropractic. Thanks.